Hi everyone, Amber Canoy here with Everyday Kentucky. November is National Hospice and Palliative Care Month, and Euretha Godby with Lake Cumberland Hospice of Lake Cumberland is with us now, really trying to also educate people that hospice is not about giving up.
Exactly.
We've had a lot of conversations, Euretha, but I want you to just kind of real briefly tell us what hospice really is.
Hospice is about meeting people where they are. You have to have a diagnosis with a limited life expectancy, and at that point we meet your family and you where you are, where you call home. We want to make sure that we can provide the needs that you require to help you enjoy that journey that you're on, and your family do that with you.
And once you get a diagnosis like that, you know, we've been talking that it's better to call hospice sooner than later because you allow people to really maximize that time. Any of us, if we know that there's a window that we have left, I would think would want to absolutely make the most of that time, not only for us, but for all of our family, make those memories, and you all help make that possible.
We try to make sure that we do the things that are special, that are important to you as a patient and to the family. And we do all kinds of activities with families to make sure that they have the best possible time that they can left to do special things with things. We've done lots of activities, like we've sent a patient to a concert. Our nurse and social worker went to the concert with her. It was a dream of hers to do, and we were able to make that happen. To making scrapbooks with families. I remember early on when I was in the field in hospice, I did a video with a patient singing lullabies for her grandchildren that were going to be born. Special things like that mean a lot, and the sooner you can get involved in hospice care, the sooner we can help you make those times special.
So if someone does get a diagnosis, how do they go about that? I mean, do they have to get their doctor to refer them? Are they allowed to self-refer?
No, they can self-refer. Okay. Anybody can call hospice. We can evaluate, get information about your physician and who you've been seeing. We can make a phone call. We can handle everything from the moment you make that phone call. And it may just be for information. We can send somebody out to talk to you and your family about the services we provide, so that you get a little bit of an idea first and just get the information, and then we can contact the physician, get an okay. Your physician is part of the care throughout the services, and we start there.
You all also provide a lot of relief for the families after the fact as well.
Right. We have a bereavement program. We follow up with families for 13 months after their loss, and we have a grief counselor that does some in-house in our offices. We'll meet people to do support. Also, we go out to the homes after the loss. We do groups in our offices locally throughout our 7 counties, so if you've had a loss, and you don't have to be a hospice patient's family, anyone are open to coming to our groups. We also have a children's program every summer. We have Camp Promise, and we have a weekend camp where they do horseback riding, swimming, and people always ask, well, how do you incorporate their grief into those things? Really, it's really amazing to watch those kids open up to each other and us as we do activities. So they go back home and go back to their school where they may have felt isolated and alone, but they are more open to knowing that there's other children just like them that has experienced losses. And our community makes that possible because we have donations, and people support our Camp Promise activities.
And they're always looking for volunteers. Of course, I would love to continue this conversation, but in the meantime, you can go on to their website for more information or give them a call.